listen, this video is regards to the little Instagram post I just put up, I think yesterday, and it made some people mad. Um, was not my intention to make anybody upset about that post. I thought it was hilarious. A lot of other people thought it was hilarious, but it offended some people, and I apologize that it did. But but forgive me. I thought it was funny. I'm sorry. I put on the caption, "It's all jokes, people. It's all jokes." So those of you guys who don't follow me on Instagram, probably have no clue what I'm talking about. So stop what you're doing right now. Go to my Instagram at Adam Deshawn. Go look at this post so you can understand what we're all laughing at. So I wanted to talk about the relationship between nurses and CNAs, or PCTs or techs or whatever you call support staff or nursing assistants where you're from. Let's just talk about that relationship. So there is a lot of tension and there's a strain between the relationship of nurses and CNAs. And I kind of want to just discuss why. You know, being that those of you guys who have been following me for the last 10 years know I started as a CNA in 2007 and worked as a CNA all the way up until 2011 when I became an LPN, when I became a nurse. So I can discuss both sides of this coin in great detail. So that was another thing, like on the TikTok or whatever I did on Instagram, like, don't come for me. I was a CNA for many of years, so I understand both sides of the coin. It was funny. Just chill, people. It was funny. So let's just dive into why nurses and CNAs typically don't get along. Okay, so number one, I wrote down some reasons. So number one, misunderstanding each other's roles, right? There's a lot of misunderstanding in what the nurse is supposed to, or what the nurse thinks the CNA is supposed to do, and what the CNA thinks that the nurse is supposed to do. So let me just give you my take on what everybody's roles are in the healthcare system. So CNA, to me, CNAs are support for the nurses. And when I say that, so whenever you have a demographic of patients that require very personal, very intimate care, CNAs are there for support for the nurse, in my opinion, right? Now, CNAs have a variety of different roles in all different healthcare settings, but specifically places like hospitals and nursing homes. The CNAs are going to take care more of the personal and intimate care of the patients. Now, with that being said, the nurses, it is everybody's job to make sure these patients are clean, turned, and dry, right? Not just the CNA. So let me just be clear on that. Whenever you have a demographic of patients who, like, let's take nursing homes for example. Whenever you dealing with a large nursing home population, you have a lot of patients who are incontinent, who need to be turned, who cannot feed themselves. So the CNA is there for the support of the nurses. It is still the nurse's job to make sure these patients are clean, turned, and dry, and fed, and hydrated, okay? The CNAs are there for support. Now, with that being said, there is no such thing as, quote unquote, it's the CNA's job. No nurses. No, it's not the CNA's job. It's all of our jobs. It's your job. As a nurse, your job is this something on me? Okay. As a nurse, your job is to ensure that these patients are cared for in everywhere that they're supposed to be cared for. Meaning, if a patient needs to be turned or dried or cleaned up and the CNA is busy, that is your obligation, sis. Take care of these patients. There is no such thing of, it's the CNA's job. It's your job. The nurse is licensed. The nurse is ultimately responsible for the well-being of the patients that is under his or her license, regardless of what the CNA is or is not doing. Now, with that being said, CNAs, let's talk about, I think this is a good time to move on to number two. CNAs think that nurses are lazy. And there are some lazy nurses out there, and there's definitely some lazy CNAs out there. So it's laziness on both sides, right? So let me just say this about the role between CNAs and nurses. And this can go back into misunderstanding everybody's roles, right? So let's say you have a nurse, right? A nurse, how am I trying to word this? So let's say CNA, you're doing your round, right? The nurse helps you do your round. She helps you turn the patients. She helps you clean up the patients. She helps you reposition the patient. She helps you to do all that, right? Because she's a good nurse. Now, when you're done with your round, you go sit down and you chart, right? You cannot help that nurse chart. You cannot help her give medication. You cannot help her do wound care. You cannot help her do 90% of her job. So let's just be mindful. So when a nurse wants you to turn a patient or clean up a patient, typically it's because she literally does not have the time to do it herself, which is why your role is even a role. Follow me now. Follow me. Don't get too mad. But that is, like I said, it's nobody's job. It's nobody's specific job. It's not the CNA's job to make sure these patients are clean and turned. It's everybody's job. But you are there as a support. And be mindful that if a nurse spends her whole shift cleaning and turning the patients, she does not have time to finish her nursing work. And remember, you cannot help her. She can help you. He or she can help you do your CNA tasks and care for the patients. But remember, you cannot in return help her or him. So be mindful when you are coming at the nurses for quote unquote not helping. They should be helping, but just take that into consideration. So number 3, nurses think they are better than CNAs. And there are some of you guys out there that think you're better. You think you're above doing like cleaning up patients. You think you're above turning patients. You think you're above feeding patients. It's some of y'all out there. And I have heard nurses say, this is not why I went to nursing school. No, sis, this is why you went to nursing school. I went to nursing school, LPN and RN. Both of my programs taught me how to clean, to provide incontinent care to my patients, and taught me how to turn my patients. You're taught that in nursing school because you are expected to do so. It is no such thing as a CNA's job. Nurses are no better than CNAs, okay? You have a higher degree, but you're no better. Right? So number 4, the difference in pay. Now, I can't say much about that. I believe that CNAs should absolutely make more money than they do. And I also believe that nurses should make more money than they are. However, we have to be mindful that there's a difference of education and a difference of degrees, just like the difference between LPN and what RNs make. So there's not much I can say about the difference in pay because I know I've heard CNA. I remember when I was a CNA, I felt like I should be making more money than the nurses. Now I know I don't believe that anymore because the nurses, or I do an extensive amount of work. And it's more of a mental stress for the nurses versus a physical stress for the CNAs. Let me hop to number 5. Nurses not listening to the CNAs when they're concerned about the patients. Now, this is something that when I was a CNA would piss me off. It would help me determine if I trusted the nurse or not. When I was a CNA, a nursing assistant, when I would come to the nurse with a concern about a patient, and she just kind of dismissed it and just kind of shrugged it off, I was like, all right, I got you. I don't trust you. You're not here for the patients. Because as a CNA, now that I know that the CNAs have such a intimate role in the patient care, they are literally the first people to see the signs of changes in this patient. They're the first ones that see changes in skin, changes in mental status, just overall changes. So it is imperative to have a very open and very healthy relationship with your CNA, because they're going to make your job easier. I mean, come on. Like, my nurses out there, have you ever worked with a good CNA versus a bad CNA? Make or break your whole shift, for real. Now, let me just say this. So I gave nurses a hard time when I was a CNA. And like, I was like, God, karma sometimes gets me back. But when I was a CNA, I gave nurses a hard time. I'm sorry, I did. I know better now because I am a nurse. But when I was a CNA, I gave nurses a hard time. I didn't do what they want. I didn't do what they wanted me to do. I always had something to say about it, which is why that meme that I put on Instagram is so funny to me, because it reminds me of me when I was a CNA. So I say all that to say this, you guys. We have it is both of our jobs to care for these patients, right? Nurses, do not call CNAs for shit you can do. If a call light is going on and you see a CNA in another room, answer that damn call light. If you are in that patient's room giving them medication and the patient needs to get on the bedpan, put that patient on that bedpan. Don't you dare leave that room and go get the CNA to have them do something that you could have done, right? Like, now tell her, like, hey, so-and-so's on the bedpan. I'm about to continue my med pass so she can go get him or her off the bedpan. But never leave a patient in a compromising situation, meaning leaving them dirty, dry, or needing to be turned. So go get the CNA because you don't think that's your job. No, boo-boo, that's everybody's job, okay? Thank you all. Subscribe to this channel. Please share these videos, like these videos, comment below about situations, or what do you think is the disconnect between nurses and CNAs at the bottom. All right, you all. Love you. Follow me on Instagram at Adam Deshawn. Bye.